segment, Hello Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello Doc. Hello Doc.
Hello, Doc.
Okay, so we're 15 minutes away from 3. Good afternoon once again, and welcome to Hello Doc. We have Dr. Emefa Dzide from the Agbawe Municipal Hospital joining us this afternoon. Hello, Doc.
Hi.
How are you doing?
I'm good by God's grace.
How's your weekend?
I was okay.
Sure. Just okay. Nothing eventful.
No, nothing much.
Oh, these days when you come, you don't share anything with us, crowd. It's like nothing happens, but I know something happens. Anyways, we're starting another week, and we get to talk about our health. Today we're taking a look at addiction. And when you say addiction, the first thing that probably will come to mind is drug addiction.
Yeah.
But I know there are other types of addiction as well. So let's start with some definition. How do we define addiction?
Okay. So addiction is a chronic. Sometimes we call it lifelong, but it's a chronic condition where there is a compulsive urge. So that means it's like an irresistible urge. They can't help themselves to seek or to seek a certain substance or to seek a certain behavior or perform a certain activity in spite of the negative and harmful consequences of that activity.
Give it to us again. Let's understand it better.
So it's a chronic condition that you have this compulsive urge or irresistible urge to take a substance or to engage in a certain activity which has negative and harmful consequences to the person. So even though there's negative consequences, they still can't help themselves but to go in for that substance or that activity.
Okay, so you know that this thing that I'm going to take is going to harm me.
Yes.
It's harmful to me, to my health, but I can't resist it. So somebody will be standing somewhere, it's like, well, why are you taking it? It's like, I can't resist. I can't do anything about it. I just feel the urge to engage in that activity or to take that substance, and it looks like I can't control it. So that is addiction.
That is
addiction.
What addiction
Okay.
is. Yeah.
What are the key signs and symptoms of addiction? How do we know that this person is addicted to whatever substance or activity?
Yeah. So addiction, it's not just about maybe a person's decision making or maybe there's a bad character. It's not just that. There's actually some chemical changes that go on in the brain that push the person to do those things. So usually it's not really within their control. So the first sign is they are not able to stop.
Okay.
That's a negative addictive thing that they are doing, whether it's a substance or it's a behavior. They're not able to stop on their own. Another sign is they have increased tolerance. So by tolerance, I mean maybe they used to take 1 tablet of whatever drug to give them that euphoric or good effect they feel in their body. Over time, they need 2 tablets to give them the same effect. Then over time, they now need 3 tablets. They now need 4 tablets. They now need 5 tablets. So they keep getting an increased tolerance of the drug that they are abusing.
Okay.
Yeah. Then another one is there's an intense focus and overwhelming, should I say, obsession with their addictions that they have.
Okay.
So they are always preoccupied, always thinking about how to get the next fix, how to get their next dose of whatever they are addicted to. So their whole time is always at the back of their mind how they are.
You're always thinking about it, planning how to get this. I need to get this, and by all means necessary.
Yes.
Okay.
Another sign is withdrawal. So when they stop their addictive substance or behavior, then they have negative effects. Usually physical effects, especially with the substances.
Okay.
So they actually feel physically ill. They actually fall sick, actually, when they stop taking their drugs. Or if it is behavior, sometimes if they don't do those behaviors, they can't function. They can't do anything else until they do what they're addicted to.
Okay.
Yeah.
Okay.
Then we have personal problems and health issues. So these people tend to maybe let go of their other responsibilities. So there's absenteeism, whether school or work. they don't fulfill the things that they're supposed to do, and then sometimes they have inappropriate social behavior. It may or may not be due to intoxication.
Okay.
Sometimes it affects their relationship with their relatives, because now that addictive substance is more important to them than their family members. So you realize they'll be stealing from their family members. They'll be aggressive towards their family members. Their character will change.
Okay.
Yeah.
Okay.
Then they are also involving themselves in risky behaviors whilst intoxicated, and sometimes in risky behaviors in order to get the substance that they are abusing or to do the activity that they are addicted to. Yeah. So sometimes they neglect their personal hygiene. They don't take good care of themselves. They don't take good care of their health. Sometimes you realize they have no motivation to do anything else. They don't have energy to function the normal functions that they have to do daily. Yeah.
Okay.
So,
All right. You've mentioned substance and you mentioned behaviors and all that. So now let's look at the common types of addiction, especially as you come across in your practice.
okay. Well, the commonest addiction that we see is actually alcohol addiction. Yes. So but in the technical terms, we have what we call substance use disorders, and then we have behavioral addictions.
Okay.
Yes. So the substance use disorders is when they are addicted to substances. Yes. So the substances could be alcohol, it could be drugs, marijuana, cannabis, however you want to call it. There's these hallucinogens, PCP, LSD. I don't know how common they are. But they take them and then they go on these wild trips. I think some are mushrooms, those kind of psychedelic things. Yeah. Then they have the hypnotic or sedative drugs. So it's like sleeping tablets, drugs that make them drowsy and all those kind of things. Then there's also the once you inhale the paint thinners and other gases, the nitrites. I think sometimes what they even use at the dentist, the gas, what they call the laughing gas and those things. Yeah. People can get addicted to those as well. And prescription medication, opioids, like those very strong painkillers, like the commonest is tramadol. That's people usually get addicted to, that we see. And sometimes medications that we use for treating ADHD, some stimulant medications, people also get addicted to. Usually the students will do it. They try to do it so that they can study long hours and all those things. They get addicted to those ones too. Then smoking cigarettes, the nicotine in the cigarettes actually can also lead to the addiction. So e-cigarettes also have some of the nicotine in them. So those are also causes of addiction. Then even caffeine as a substance.
Okay.
So a lot of coffee can also be addictive. So those are the common substances that we see.
Okay.
Then when it comes to the behaviors, the commonest one is gambling.
Okay.
Actually, gambling addiction. Another one is probably watching pornography.
Okay.
Yes, that's also one of the big addictions that we see. Then there's sex addiction. There's people who are addicted to eating. There's people who are addicted to shopping. Some people are addicted to like
shopping.
Yes. So some are addicted to even shoplifting.
Okay.
So they get some
high
from stealing stuff. So then they always, so you see that the person is very rich. The person doesn't even need any of the things. They'll steal, like a man who go and steal lipstick. Like, why does he need it?
Getting some high from stealing it.
Yes.
He wasn't caught.
Yes. Sometimes internet gaming, they get addicted to gaming. And sometimes just even using your computer a lot. Sometimes TikToking, just watching videos upon videos, people can actually get addicted to it. Yeah.
Wow. It's interesting. It's interesting to note that. But what are the risk factors for developing addiction? Because you can have different people being exposed to the same substance or behavior, but it's not everybody who gets addicted. And sometimes it makes you wonder, is it that someone is weak and another person is strong? What are the risk factors there?
So usually the risk factors are a combination of different things. So it's a combination of your brain chemistry and then your environment that you are in, and also maybe things that happen to you in your lifetime, especially in your early childhood.
Okay.
Yes. So the genetic aspect, if you have a first degree relative, that's like mother, father, brother, sister, who has an addiction problem, then you are maybe 40 to 60% likely to also have an addiction.
Wow.
Yeah, but that's it depends on a whole lot of other things. It's not that because maybe all your family members are addicted, you're also going to be. Depending on the other factors. Another factor is mental health conditions. So if maybe you have some disease like depression, post-traumatic stress disorder, bipolar disorder, it can lead you to addiction. Sometimes to these diseases, it's like a vice versa. So the disease can lead to addiction. Addiction can lead to
the disease.
The disease
Okay.
as well.
Okay.
Yeah. And then there's environmental factors, as I mentioned. If maybe the drugs are always around you, you own a drinking bar, and the drinks are always there free for you to take whatever you want. Yeah, so it's a higher risk for you to indulge in those kind of things. And then also, as I mentioned, adverse events in your life, especially in childhood. So if there's some abuse, or if maybe there was an accident you were involved in, you saw someone die, something that really traumatized you as a child, that gives you a higher risk of developing an addiction.
Okay. So for adolescents or young adults with addiction, what unique challenges do they face, and how do we address that?
Okay. So with young adults and adolescents, they within that age period, they have let's say higher levels of certain hormones. Okay. Usually adolescents, they are now transitioning from childhood, and they are not really able to. Sometimes the hormones just go really, really high. They feel things more intensely and those kind of things. So those kind of feelings that they have, the way they feel things more intensely, can lead to them like going in for substances or behaviors to try and then calm those feelings down.
Okay.
Yes, so usually that's what happens with the teenagers and the young adults, but really anybody can have an addiction.
Okay. Okay, so we're talking about addiction. We're not going to be able to exhaust all of that. So we'll continue next week. We'll do a part 2. We can look at treatment and all that. But let's look at some common triggers for addiction and how patients can actually avoid or manage them. Because like you said, if, for instance, in your environment, you're being exposed to a whole lot of stuff, what are some of the common triggers for that person for addiction?
Okay, so it's usually if they have like maybe a negative life event,
Okay.
or they have maybe a lot of pressure on them, and you'll be surprised at the pressure people have. It quite varies, because maybe you will see, this young teenager, to what problems does he have in life? But then depending on how they developed cognitively, like the brain developed and understood things going on around them, they tend to feel certain things as stress, different from the way other people feel. So actually anything can trigger. Any negative thing can trigger. I want to talk briefly about like the biochemical aspect of it, so that we can kind of understand what goes on. So human beings, we are motivated to seek rewards. So if maybe you do something and then you get paid for it, you would want to do it again. Yes, that kind of thing. Once you get a reward, you want to do it again. So now we have this reward system in the brain. So you do something, you do an activity, you take a substance, and that reward system, it hits and produces this hormone called dopamine. Okay. And then it hits, and then it gives a very nice
a good feel,
a very nice and pleasurable feeling. Yes. So normally when maybe you are with a loved one or something, you eat a delicious meal, you get a hit, you feel good, you do pleasurable things, you feel good. Yes. So now when the person associates that good feeling with that negative activity, And some of these, especially the substances, they can give this exaggerated dopamine response, and they can quickly make a person get addicted. So something like heroin, it's very addictive very quickly. It's more, it's faster than maybe.
And that's what we call it, the high, right? So it takes you to a higher
so
level.
In the brain, like there are certain pathways. I don't want to be too technical, but there are certain pathways, and it would go so fast, and it would desensitize your reaction. So you need more of the dopamine to get that high feeling, and you can't stand not having the high.
Okay.
Because you are used to that highness. So not high in a sense of drug high, but like let's say a sense or a feeling of highness. Yeah. So usually when that comes, your brain now links that high to other things. So if you don't have that high, you won't be able to concentrate and do your work. You won't be able to you won't be able to eat. You won't have appetite. It's like it affects the brain in a very complex way. So once you keep getting the highs from that, you are unable to get high from anything else. So any other things that should normally give you pleasure are not giving you pleasure. The only pleasure is that addictive. Yeah. So it's quite complex, and it's quite difficult.
You know what I'm getting from this discussion? Because usually you find people judging addicts, right? People who are addicts, you find people judging them. But I'm getting the sense that we rather have to help, understand, and then support these persons to hopefully come out of the addiction, because it's always like it's in their control that I want to get addicted to this one, where we put blame on them for being addicted.
Okay, yes. Well, they do have to have some sense of
responsibility.
Yes, thank you. They should have that sense, because without that sense, they can't come out of it.
Okay.
Yes. So if you don't let them take responsibility, and you are too kind and too understanding, they will never get out of the addiction.
Okay.
At the same time, too, you have to also understand that being too harsh on them will also push them further into the addiction anyway. So it's not very easy. But one thing you should know is you should have compassion for them, because it's a brain disease.
Okay.
It's like someone having depression. It's like someone having bipolar. It's actually a wrong functioning going on in the brain that needs to be corrected.
Okay.
Yeah.
Okay. All right. Next week we'll get to look at the treatment of addiction. I don't know if there's anything you want to add for today as we wrap it up.
Okay. No, just to emphasize, it's a chronic brain disease. Okay. And the same way, if you want to prevent a disease from getting worse, you treat it as early as possible. You should try, and then when you see the signs in yourself, in a loved one, you have to try and get help as quickly as possible before it gets to a very dire or very destructive point.
Okay. All right. Thank you very much. That was Dr. Emefa Dzide with us this afternoon on Hello Doc, as we take a look at addiction. We'll do a part 2 next week, and we'll get into treatment for addiction. Thank you very much, Doc, for coming on the show this afternoon. We've done 3 minutes after 3. This is The Drive with the Area Gang. In a